Hello. Five. Hello, welcome. I am just trying to figure out a few things, trying to make sure my guests are on. I'm trying to have this on Zoom and Facebook at the same time. And, well, maybe I should go back here. Hello? I think I figured it out. I think I figured it out. Hello. Hi. Hey, beautiful. Oh my gosh. I was like, okay, what am I doing wrong? I knew I was doing uh before we get started, hey, does the Zoom record like a few seconds ahead of time? Because I'm hearing myself.
Yeah, there should be a lag.
Are you still hearing yourself? Hi, Vita!
Yes.
I could see one way. So Ollie and I are sitting next to each other. So we'll make sure Ollie's audio is off and my mic is on. So we'll just make sure to keep one of our mics muted. Hello, John. And I'm sure that Julia will be hopping on when she can.
Okay. So should I turn my mic off or what? How do we?
So you're hearing a lag on your end. You're hearing your voice repeat.
Hmm.
That's so weird. It's not happening on my end. I wonder if that is part of the recording. Maybe. Yeah. That'll
Right.
be.
If
Yes.
you have your laptop
Oh.
or speaker elevated, it might echo
Oh.
depending on where the speaker is sounding into. I know that sometimes if I have my laptop elevated on certain things, like on the table, the echo is really bad.
Okay. I think I
Good
figured it
tip.
out though. I don't hear it
Okay.
anymore. I think because I had the Facebook app opened and this Zoom, because for some reason, I'm thinking in my head that I need to have them both open, but maybe not. But welcome, guys. Welcome, welcome, welcome.
Hello. Thank you for having us. Yeah.
Thank you guys for agreeing to hop on with me to talk about this very important subject, and that's HIV and AIDS in the Black community. I just really wanted to raise awareness about this. Let me tell you how I came up with this. I knew it was something that I wanted to, like last year when I was thinking about, okay, Wellness Wednesdays and what I wanted, topics that I wanted to talk about. This is one of them, but it was going to be down the line because I really wanted to talk about diabetes at first. But you know how when you're Googling, like, what are the awareness for this month? And HIV and AIDS popped up as, I think for last week, it was HIV and AIDS Black Awareness. So it's like, okay, this is what we are starting with. So first, I just want to introduce myself to the audience. I'm Odessa. I am the owner of Wellness with Odessa and also Boston Square Wellness Collective. And this is my first segment, or our first segment of Wellness Wednesdays. This is something that I've wanted to do for a while now. Just create a space where the Black or the BIPOC community can gather and discuss um, anything from dietary related illnesses to HIV and AIDS awareness to financial health, mental, all of it. But we're starting with this today, and I'm super excited. First, I am just going to give each of you a chance to um, introduce yourselves, and then we'll just get into it. We'll start with you, Olivia.
Sounds good. Hi, my name is Olivia Lohman. I am originally from the Upper Peninsula of Michigan and have been in Grand Rapids for the broadside of 4 years now and am loving every moment. I am a HIV medical case manager and have been working in this field for just going on 2 years.
Thank you. Who's next? Nikita.
Hi there. My name is Nikita Miner. I'm a community health worker here in Grand Rapids, and I worked in HIV case management for over 2 years and was formerly a part of the Red Project as well. Thank you.
All right, thank you. Ali.
Hopefully, you'll be able to hear me through Olivia's audio because I want to turn my house up plus. Hi, I'm Ollie.
Can't hear Ali.
Yeah, use it on your phone.
Yeah. Okay.
Okay, now I can't hear.
There we go.
There we go.
So my name is Ollie Irwin, and I've been working at the Red Project for a little over a year at the front desk, and I do like administrative assistant stuff. I don't remember, but I said previously before you couldn't hear me, but yeah, I'm pretty new to harm reduction, pretty new to like the prevention and the awareness. I'd been working in kitchens previously, so like yeah, I kind of just dived in head first, and it's like become something that I, you know, um, I've completely immersed myself in with this, like the desire to, spread that awareness to other people who don't have it.
All
That's
right.
all.
Thank you. Thank you. Who's next? We have
Go
Vida
next.
or
I can go
Julia.
next. My name is Vida. I'm from Benton Harbor, but I've been in Grand Rapids. I can't tell you how long because that'll give my age. And I've been at the Red Project almost 2 years, and I'm a EIS early intervention specialist and a medical case manager.
Thank you.
Mhm.
And lastly, but not least, we have Julia.
I
And
think
I
she.
saw in the chat, Julie had to step out for a
For a minute.
second, but she'll let us know when she's back and then we can do her intro.
All right. Well, you know what? We're just going to hop right into it. I started doing research on HIV and AIDS. I am not a professional. I'm not well versed with the HIV and AIDS language, if you will. But I have been doing some research, and it just blows my mind. The statistics blow my mind. And I just wanted to start here with this statistic right here. And I have it on my little notes. And then we can go from there. Hold on. Just got to get to it here. Okay, here we go. This is what I found, and this was on the I think it's the African American Health. I believe it is. I'll get it. I'll find that the link to that. But anyways, here it goes. It says although Black African Americans present almost 13% of the U.S. population, they account for 42.1% of HIV infection cases in 2019. That is staggering. 13% population and 42%, more than 42% of the new cases are African Americans. Let's talk about that. Let's kind of dive into it. First, what is HIV and AIDS? Like, what is the difference in those two? Because I think a lot of people think that they're the same, they're changeable, but there's a difference, right?
Yeah.
Who wants to answer that?
Here, I'll go ahead because I'm not sure what they have planned for the rest of the question. So, HIV is a human immunodeficiency virus, and AIDS is just that virus progressed to stage 3. And so,
Mm,
actually, you can move between stages. So, HIV stage 1 is kind of like you get sick, you don't really know. It could be a latency period where you could be living with HIV for over 10 years and not have any symptoms. And then stage 2 is the stage that most people are living in, which is active virus, and also they are um, taking their medications. Hopefully, a lot of folks will be taking their medications within this stage so that they can keep it within that stage 2 and doesn't progress to stage 3. And stage 3 is AIDS. So when you think about AIDS, when you think about Ryan White, you think about the 80s, you think about the early 90s where people were losing community members, the queer community, the Black community. Everybody was losing members to AIDS, and that's just stage 3 of HIV. So we kind of have moved away from the language of saying, oh, he has AIDS, when really it's just a virus that he has and he's managing it through medication.
okay. So it's sort of like if someone was diagnosed early with cancer, there's stages. You have like the stage 1, then you go to the stage 2 and 3, and then the more advanced.
What
Right.
is slightly different there also from a stage like cancer, or my understanding of the stages within cancer, is that someone could get to that stage 3 of having AIDS, but then through their treatment through regularly adhering to their medication, through going to doctor's appointments as scheduled. They can work backwards to different stages. So just because someone has AIDS at some point in their life doesn't mean that that is where they stay forever. That is their continuous diagnosis across time.
Correct.
So what I'm hearing is that it's not necessarily a death sentence, because before, I think one of you said back in the 80s, 90s, it was almost, you have AIDS and people were dying left to right. So if you have AIDS, with the advancement in medication and treatment, you can reverse it somewhat, is what you're saying?
Yes, you would take retrovirals, and so a retroviral would be making it so that the load, the amount of HIV that is in your system, the amount of virus that is in your system is decreased to a certain level. Usually what we call that level is remind me, what do we call that level when you get to
undetectable?
When you get to undetectable, it means that they have to use more instruments to be able to detect the amount of HIV that is in your blood.
Okay.
Yeah.
There's actually a national campaign going on right now called U equals U, undetectable equals untransmittable. So what that means is that if someone is undetectable, their viral load is so low in their blood that it's not able to be detected by the technology that we have in the healthcare field at this time, it is unable to be transmitted to a sexual partner or just transmitted in general. So there's this national campaign, U equals U, undetectable equals untransmittable. And if someone does reach an undetectable status, they are not required to disclose their HIV status to a sexual partner because it's untransmittable at that point.
But it's still considered HIV then, or is this so new to what they're still saying this is HIV, because this is still new. This is something new, right?
Well, actually, it's the meds that Michael, what is it? Michael Johnson, Michael Jordan? Not Michael Jordan. What's the man name?
Magic Johnson.
Magic Johnson.
Magic Johnson. Yeah. That he was on because he was undetectable. That's why he wasn't transferring it to his wife, because he was on meds that could make him undetectable. But at the time, only people with money could get it. Like Charlie Sheen, they.
Oh, yes. I forgot about. Yeah.
Yeah, it was something that people with money can get, but now it's offered to everybody, low income.
I'm just hopping on here to see if anyone has somebody jumping on Facebook, have questions. Let's go live. Now I want to get into, now that we know what HIV is and what AIDS, what that is. Now I just want to get into how it affects the Black community. And I sent you guys some questions, and this is by no means, these are the only topics or areas that we can discuss. These are just some things that I had wanted to know, and I wanted to share with the audience. But feel free to, break off into other areas. I'm sure there's some things that I don't know about. All right. The first question, and either of you all of you guys can answer, or one or two, however you guys want to do it. We've already said what is HIV. You guys have answered that very well. Who's affected most by the disease? Obviously, the subject is Black awareness, okay, and HIV in the Black community. And we kind of talked about the statistics. Was I right with the statistics? Is there anything else you guys want to add to that? As far as who in the Black, we know that the Black community suffers most from HIV and AIDS, but who in the Black community suffer more, or who's diagnosed more? Black men, Black women, gay men, gay women. Let's talk about that.
I have some statistics that I pulled for answering that question, but certainly I think we can all take a stab at this one. You were right on the money. The latest statistics that I've seen are from 2021, where more than 40% of new HIV infections in the US occur among Black people, despite only making up that 14% of the US population. So this is more than 40% of new infections are occurring among Black people. Also in 2021, of all the people living with HIV in the country, so these aren't new diagnoses, but people who are already diagnosed and living with HIV, 40% of the people living with HIV in the US are Black. So it's not just the new infections coming in reaching that 40%, but people actively already diagnosed and living with this disease are making up that 40% as well. Yeah. Among Black African American men, in 2019, Black men accounted for 3/4 of new HIV infections among all Black people in the US, with 82% of infections attributed to MSM contact, which is male-to-male sexual contact. Specifically, queer Black men are less likely to receive an HIV diagnosis, to be prescribed PrEP for prevention, which we'll get into that a little later, and they're less likely to be suppressed virally compared to other white, gay, and bisexual men. So Black men is a huge portion of how HIV is disproportionately affecting people in the country, but also Black women have some staggering numbers. For Black women, sorry, I capped all around.
So Black women do not lead in the diagnosis with, because I thought that Black women made up for more numbers. That was what I got, but you're saying that it's the opposite or close.
So with Black women, 91% of their new HIV infections are attributed to heterosexual contact. And among all women of races and ethnicities, HIV infection rates are the highest among Black women. And I believe off the top of my head that they account for 64% of HIV diagnoses across the country as Black women.
Staggering. Oh, yeah. Wow. Anyone else want to add? Go ahead. No, finish what you were saying, Olivia.
I was going to say that's also not taking into consideration Black transgender women. Black trans women account for 62% of the HIV infections among all trans women living with HIV in the entire country.
So all the way around, it seems like we are the Black population, whether heterosexual, homosexual, queer, we are suffering. And that is something that we really need to, it's been so taboo, I believe, to talk about in the Black community, but it's definitely something that needs to be discussed a lot more. Anyone else has more to add to that? If not, we could keep it moving.
Yeah, I can add a couple of things. Thank you so much for bringing out the numbers, Olivia and Odessa, because for me, I think that how I have always operated and worked is when you think of quote unquote the least of these, because I have come from a pretty churched up background, you know what I mean? So I think in phrases like that. So when you think of the what's it called? SDOH, which is SDOH for men. What is it?
Social determinants of health.
Yes, when you think of social determinants of health, the folks who have the least amount of health access are the folks who are going to likely have the highest numbers of diabetes, heart disease, HIV, all of the things that would affect your health. those are the folks who are going to get it the most. They're going to get hit the hardest. Usually it's because of maybe not having access to testing, or maybe not having health insurance, not even thinking, oh, I should get tested. A lot of folks, they just use condoms. Condoms break. They don't know about things like PrEP, which is pre-exposure prophylaxis, which means, you take a pill daily or you take a shot every couple of months, and that will protect you from having HIV, from getting HIV from a sexual partner. Not necessarily through blood contact, because they haven't necessarily tested that. But when it comes to having intercourse, which is how the majority of folks are actually getting HIV, and through their sexual partners, whether they be partners they've had for a long time, short-term partners, one-night stands, it doesn't really matter. When it comes down to it, is people got to protect themselves, and they don't have the tools to always know how to protect themselves in the best way. And so PrEP has been pushed out to the white gay community, which is why their numbers are so low, because they can take a pill daily, and that pill will keep them from contracting HIV from their sexual partners. And then when we talk about the kind of sex that people are having, I kind of try to stay away from the word risky, like the quote unquote riskier sex, when people say, backdoor anal sex is just riskier than every other kind of sex. Not necessarily. There's ways to be able to have anal sex that will allow you to not have so much friction. Because what happens with HIV infection is it's the friction. It is either there's not enough lube or things like that, and you get those micro tears within the vaginal wall, within the anus, and that is how HIV is spread, is through those micro tears from blood and sexual fluid contact. So people don't always know that, and a lot of people don't get tested every every month as so many other
Mhm.
folks do. There's a lot of folks who get tested every month because they are aware of how to take care of their sexual health. Some of us didn't even have the conversation with our parents. Our parents never said, hey, our parents never said, hey, you should get tested. Here's what a condom is. You need to use lube, blah, blah, blah. No, our
That
parents
goes
said,
back to
let's
the
not,
taboo,
it's
especially in the
taboo.
Black community. Yeah. You just
Exactly.
don't talk
Do
about
not have
things like that.
sex at all. And if you do have sex, don't be pregnant. That's
Mm-hmm.
That was the
us as
number.
Black
Yes.
women get. I
Um,
think Vita is
before
open.
Nikita didn't go over the PEP pill, the pill you take within 72 hours if you think you had contact with a person that was that may have been positive. There's a pill you can take if you do it within 72 hours.
Yeah.
okay.
Post-exposure prophylaxis. Yeah.
Yeah.
Before we get too far into that, because I want to come back to that, being that we are here in Grand Rapids, we're in Kent County. Do any of you have statistics, the numbers in Kent County? Does anybody know, like, what
Yeah. So
percentage wise?
finding information specifically for Kent County, that was a little tricky, but I do have some information for the state of Michigan as a whole.
Okay.
What I did see for Kent County was that there's 40 new cases on average being identified every year of HIV in Kent County. That wasn't broken down to race or ethnicity.
Race. Okay. Okay.
As far as specifically within Michigan, we continue to see these disproportionate numbers. So at the end of 2020, there were 7,000 Black men living with HIV in Michigan compared to 5,000 white men living with HIV in Michigan. So that's every 2 white men living with HIV, there are 3 Black men. When we look at prevalence rate, we see that really large disparity. So for every 2 white men living with HIV per 100,000 people in Michigan, there are 15 Black men. Overall, Black adults account for 14% of the Michigan population, but represent 58% of all HIV cases in the state. So it's that same thing of nationally only accounting for 14% of the population, but holding 40% of diagnoses. Statewide, only accounting for 14% of Michigan's population, but representing that 58% of all cases in the state.
That is still just blows my mind. Blows my mind. Let me get back to our next question that I have for you guys. But feel free if you want to add, if there's something you feel that needs to be said, needs to be shared. Feel free. Hold on.
One thing that I wanted to touch on quickly that is slightly off course of the questions you prompted. I wasn't sure where it would necessarily fit in, but it feels important to state. Like what Nikita had said about wealthy white gays being given the access, we also see that funding for HIV care and prevention through Ryan White funding is another really good example of how white-centric this treatment is. So Ryan White was a child who had acquired HIV through a blood transfusion when he was young. There had been people dying of HIV and AIDS for decades up to that point, but they were predominantly BIPOC people. As soon as all of a sudden it's this white boy who is being affected, now there's national outrage and concern, and what do we do here to fix it? And a lot of funding for HIV care comes from the Ryan White Foundation, which is dedicated to this young white boy. And I just think that that's an indicative core to a lot of what we're talking about.
Oh, wow. Oh, wow. Hold on, guys. For some reason, my phone, it didn't die, but it said that I couldn't get back on for the next 5 minutes. So I am trying to get to our questions that I had for you guys earlier. Hold on. Hold on. And if I can't get to it, I'll just. Guys, feel free to, I'm a little bit, when it comes to this technology thing.
Nikita put the questions in the chat. Thank you, Nikita.
What was that, Ali?
Oh yeah, sorry. I said Nikita put the questions in the chat that you had sent us.
Oh, okay. All right. What was the next question?
I think it was number 3.
No, it was number 4.
Oh, okay.
Okay. What was it? And then you guys answered. Feel free to jump in and answer.
It is, what are some common misconceptions about HIV and AIDS in the Black community?
Who wants to answer that?
I think that I think me and Vita can tag team. Julia, if you want to pop in too, if you are comfortable. I think for a lot of folks, there's this misconception that all Black men get quote unquote AIDS when they go to prison, and then they come out and give it to their partners. And I think that is a testimony to medical racism, because when you think about people who are able to get access to care, when you go into prison and when you go into jail, they actually test you. So those people actually should know their statuses when they come in when they go into those jails, when they go into the prison system. But we already know that Black men and boys are disproportionately affected by the prison industrial complex when it comes to medical care. A lot of Black women and a lot of Black men don't necessarily feel the most comfortable going to the hospitals to get, to get all of their testing done and things like that. Maybe they rely on clinics. Maybe they rely on, tests that, maybe they go to the Kent County Health Clinic or things like that. But I think that there is an idea from, like, I think it was an Oprah special that talked about men who are on the down low. I think that we don't need to talk
Mm-hmm.
necessarily all about men who are on the down low, quote unquote, spreading the gay disease. I think it's more apt for us to be able to have a conversation about sexual health and being able to be to the forefront about sexual health and sexual pleasure. Like, people have these ideas around sexuality and specifically homosexuality or queer sex, that it is nasty, that it is dirty, that it is this, that it is that. And honestly, that's what ends up killing people, is the stigma around having gay sex, or the stigma around being with somebody who is bisexual, or the stigma around being HIV positive, or um, having even chlamydia, because a lot of folks, or other sexually transmitted infections or diseases, because if you have, like, say, syphilis, it's more likely that you are at risk for also contracting HIV or coming in contact with HIV,
Mm.
because you have sores on your genitals and things like that,
So open
that
sores.
open
That's
sores
an opening.
exactly for HIV to enter. So when I was in my working as an HIV medical case manager, I came across folks who had multiple diagnoses, right? But HIV was the one that stayed with them forever. Herpes is the one that stays with you forever. And I think that when we talk about the sexual health part of it, I think that if somebody gets the flu, it doesn't stay with them forever. But if you get HIV, that's a virus that stays with you forever, right? And so for a lot of
Mm-hmm.
folks, that's where the stigma comes in. Is like, you can't get rid of it. You're dirty forever. And I think that a lot of
Mm-hmm.
folks, I
Yeah,
want other folks to jump in, but I'm sure, Odessa, you have some thoughts about that too. But that's just how I've
the
thought about
taboo
it.
part of it.
Yeah.
Mhm. The
Go ahead.
Yeah.
taboo part of it is, or the misconception that HIV and AIDS, and I, in my younger years, it's a gay disease. So we really don't have, if you're heterosexual, especially heterosexual woman, that is something you don't have to really worry about because it's a gay disease. And what I've found over the years is that HIV and AIDS definitely do not discriminate
Yes.
according to or your sexuality
If you
based on your
guys don't mind, I just want to piggyback on what Nikita said. Let me turn that down. But just like, yeah, going again with what she said about like misconceptions about homosexuality and I guess quote unquote gay sex and the stigma and all of that, like creating that sort of isolation of the the people who are affected, and like making you feel like if you do have a problem like that, you aren't allowed to seek out help for it because you don't want to be seen as somebody who interacts um, with another person of the same sex or whatever. And yeah, just like what you were saying, Odessa, about like how people in the Black community, especially, uh, uh, like they will say that women aren't like at risk for that, and they weren't affected by that because like it was predominantly just men who are having sex with men, and yeah, again, just going with that like theme of it being like a dirty thing. If you just like keep out of whatever it is that homosexuals are doing, like you won't get involved, you won't be touched by that, and it's like so not true. And I feel like is another reason why things have escalated statistically the way that they have is because everybody's just so like nobody say anything, and then it
Right.
got to a point of boiling over.
Right. And
Yeah,
I'm just wanting to get away from that. Because I think the problem in the Black community, we see it, like I said, as a gay or lesbian problem, and it is a Black community problem. And
right.
I I try not to. I want people to be helped. You know,
Yeah,
here I am, heterosexual, born again Christian, but I see the effect that this disease has had or is having on our community, and it's like
absolutely.
we just need to help, and we need to
Yes,
be talking about this more, because in the end, that is what's going to, I think, um, it's going to it's preventable. We're teaching
yes,
people how to
yeah.
prevent.
Like Nikita is saying in the chat, you got to talk about it.
Yes,
You got to talk about it.
you got to
It
talk about it.
it is really important because um you had just said something that gave me like a thought of like just how the creation of like segregation within our own community between people who are heterosexual and people who are homosexual, just like the way that the media portrayed it when people were first realizing that it was an issue, like it caused there to become that rift even more so between homosexual people and heterosexual people, because heterosexual people were like, oh, I'm definitely not helping you now because I will get sick if I come near you, and there was like this misconception that like I've just got to stay away, and then it'll like like I don't know, work itself out between the people who were having that issue. But it's yeah, definitely so necessary for everybody who is affected here to look around and see everybody is affected here.
Right, right. We're doing the work. This is what
Yeah.
we need to be doing more of. So I'm so happy that we're doing this. So we've talked a little bit about the misconceptions. Next, because I think a lot of people think that I feel fine, so I don't really need to get tested. There's nothing wrong with me. And I think, Olivia, you had spoken this earlier. So I'm just going to ask, are there any specific known symptoms when you develop or when you contract HIV? I say HIV because HIV could lead to AIDS. So are there any symptoms? Are we fooling
Um,
ourselves thinking that, oh, we're fine, I don't really need to get tested? But
yeah, I can speak to it real quick too. So the first stage is that flu stage. So acute HIV infection means you have been um you know, the virus has made its way into your system. It feels like you have the flu. You might have the aches and pains, runny nose, for a few days, and then it could go away. And for a lot of people, that's what happens. They don't know to get tested when they have flu-like symptoms, a few weeks after having sex with a partner, and then it moves into that chronic HIV infection. So it could be asymptomatic for a long time, but then it'll start to kick up and it starts to beat down your immune system. That's when you start to get towards. That's when your viral load starts to decrease or it starts to increase. So your viral load per capita per blood, when you do a blood test will increase. But because it's beating down your immune system, human immunodeficiency virus, your white blood cell count starts to fall. And if your white blood count starts to fall too much and gets to that 200, right? Below 200, now that starts to get into that stage 3 of AIDS, of HIV stage 3, where you can get taken out very quickly from something as simple as a cold, from the
mm,
flu. You become your body becomes susceptible to something called opportunistic infections. So you could get rare types of cancer that you only see in patients
Wow.
who are living with HIV. And that's why people should test as much as they can. So get tested every few months because there's a period of time. And I think Olivia, Ali, and Dita, my brain is a little bit old on this information, but the time between having a sexual partner and getting tested, the amount of time that could pass could be like 2 to 3 weeks. And so some people will get tested the day after they've had sex. I'm like, I might have HIV. We wouldn't know until maybe 2 to 3 weeks out. So you would need to come back to get tested 2 to 3 weeks out. People think that they take a test right away and then they're set. But no, the
Mhm.
period of where the infection starts to hit your body actually
It's
really
three
doesn't show up until
three
two to three
weeks.
weeks out. So correct me if I'm
Okay.
wrong,
So,
y'all.
but
I
people
know
are
Dita
probably
is
just
here
in
too.
that, they're probably just in their back of their head, they're fearful and like, okay, I need to do this right now. And they could be missing if they're doing it too soon, right?
It's
Right,
scary.
But
right,
we are,
absolutely. So, oh, sorry. I was just saying, like,
okay.
I think sometimes directly after a sexual encounter with a person, and you find yourself like worrying that maybe you had an exposure and like stress related symptoms can occur, and you like think to yourself like, oh well, I have a stomach ache, or I feel achy, but yeah, so there is a window period from the point of exposure that the point of exposure from it is 14 days. So you wouldn't be able to get a test that would be able to be considered like a valid test for like a proof of whether or not there is a sign of HIV present in that person's blood until 14 days after the point of exposure. So as much as it is like, like that, you want to rush to test, and you even if you did test, you could get a false negative, and then like you could reassure yourself that you are negative, not get a test later on in the future when that point of exposure occurs, and you would be able to have the valid test and then miss the opportunity maybe to like catch it sooner, and stuff like that. So
But if
All
you're
right.
that scared right away, you can go
I'm on
and
mute.
do the 72-hour pill.
You can do what now?
The 72-hour pill that if you feel like you've been exposed to it versus,
Oh, yeah.
worrying about it, just go to the emergency room and get the
The 72-hour pill
is what
or
is
the
called
PrEP
Right,
pill.
right. Oh,
prophylactic.
good job.
All right. Well, we got about 15 more minutes. I think that this is definitely something that we need to revisit, have a second
Yeah.
segment on. Um, but my next question, and feel free either, I don't care who answers. Let's discuss the intersectionality of HIV and AIDS with others. So we may have kind of touched on it a little bit with other social determinants of health, such as poverty, education, discrimination, and access to health care. Because I know that for a fact that those things are really what keeps people from getting, access, having access, getting tested.
There's so much here, so much overlap there.
Yes.
Social determinants of health absolutely impact outcomes along the HIV care continuum. One specific way is that over 50% of individuals living with HIV in the US are 50 years of age or older. So we got to
Really?
look,
Oh,
yeah,
wow.
so we got to then look at the infrastructure of, are you muted?
Yeah.
We got to look at the infrastructure uh, of assisted living and places for people to go that are aging. we're also seeing something called HIV associated neurological disorders showing up. So it's also known as HAND. But this
Say
is,
that again. HIV and what is hand again?
yep, HIV associated neurological disorders. So in the same way that Nikita was just talking about these opportunistic infections, if someone has a predisposition for memory loss through dementia or Alzheimer's, that can be accelerated and amplified by HIV and
Hmm.
having it be more significant in the body. So if someone did have AIDS, there's the potential that they could have gotten some lesions in their brain in the process that can be part of these associated neurological disorders. But ultimately, they move someone closer to these memory loss symptoms and difficulties with their neurology. So we can see how that can intersect with so many other areas and social determinants of health. But then outside of that, I mean, if someone is unhoused, how are they going to be able to take their medication at the same time every day and
Mm-hmm.
maintain their undetectable
Mm-hmm.
status? I have a client who would go and pick up her meds from the pharmacy and then all of a sudden would have all of her belongings stolen when she was unhoused. And so then a month's worth of supplies, a month's worth of meds were out the window. And those
Oh my God.
medications can be upwards of $3,000 to $4,000 per month without insurance for HIV
Whoa.
medications.
Whoa.
Um, so having that lack of accessibility to safe housing, transportation to get to and from appointments. Does your neighborhood have food and nutrition access or access to health centers? What are job opportunities? What's your income like? Is there substance use going on? Are there mental health difficulties? So many intersections can occur.
That is so interesting. The neurological effect that AIDS. That is something I need to do some research on because HIV and dementia, Alzheimer's, that is new to me.
Well, for me,
Um,
because I'm older, I'm like you. I work there and I'm still learning things. It's always something new. It's always something more. So it's just a matter of continuing to be willing to learn these things because I'm still learning.
gotcha. Gotcha. Um, so let's talk, being that we only have a few more minutes, let's discuss care. Like if you have HIV, if you've been diagnosed, especially if you're new, if you've been diagnosed like recently, um, how do you take care of yourself? Self care, medication, and then let's talk of prevention, like care. Let's start with care.
Well, our program, we try to connect clients that we get that come into us with a doctor
Mm-hmm.
that can address the HIV. And once they get into a doctor, that moves them to, if there's other things going on, they can be referred to a primary doctor, diabetes doctor once you get them there.
Okay. All
And
right.
as far as the
And this is something
medication,
that the Red Project. This is where you guys work, right? That
uh-huh,
is something that Red Project does for their clients.
yes.
Connect.
And we help with housing with HOPWA. We connect them with housing with community rebuilders.
Okay. Rebuilders.
So HOPWA is housing opportunities for people living with HIV or AIDS. And it is I believe, government assisted program for housing assistance for people living with this HIV diagnosis. That's something that we're able to connect people to with care. Um, Really, like Vita said, getting into doctors, making sure that people have the food that they need. Sometimes HIV medications have to be taken not just with food, but with a full meal. If
Oh, wow.
someone doesn't have the ingredients to cook with, or if they don't have a stove to cook on, they don't have a can opener, I mean, there can be some really big barriers there. So how can we try and overcome the barriers and pitfalls that show up in, frankly, a world that has a lot of structures that actively perpetuate harm against the people living in it?
Okay.
So how can we navigate that together is a big part of the care piece.
Okay, we got about 5 minutes. Where can people go? Like, give us some resources. Can you provide the audience with resources? Like, where can they go to get information on care, housing, information on prevention? Give us some resources, some organizations that people can connect with.
So people can come to the Grand Rapids Red Project, Kent County Health Department, or Trinity Health to get HIV testing done. As far as medical case management for people living with HIV, Trinity Health does have case management. Grand Rapids Red Project does have case management. But there is a lack of resources. I mean, we have some for sure, but we want to also have enough that people are able to have a choice between providers too. And we're still building that. Catherine's Health Center, I believe, is in the process of creating an infectious disease department. So that will allow more options for people. HOPWA is through Community Rebuilders, which is in town. There's the Michigan Drug Assistance Program, which is funded through Ryan White funding. This can help cover the costs of these huge medical expenses, monthly prescription expenses that come in. People can
maybe you before we get off quickly, is it covered by Medicaid? Maybe you said so and I just didn't hear you. Is it covered through Medicaid, Medicare?
So most things are covered with Medicaid. However, there can be costs that are not covered by insurance. That's where MIDAP, the Michigan Drug Assistance Program, comes in to cover the cost of what insurance does not cover and fill those gaps.
All right. Thank you. Thank you. Thank you. Thank you. Like I said, this is something that I think that we need to maybe even next month revisit, because I feel like there is so many areas that we are not able, don't have the time to touch on. But thank you guys for doing this with me. I so appreciate it. I reached out to you, Olivia, and you were like, yes, let's do it. Thank you, Nikita. Thank you, Ali. Thank you, Vita. Thank you, Julia, for coming on and talking about this with me. Thank you for all who joined in. I don't know if there's questions on Facebook. I wasn't able to figure out how to have my iPad and have it going. Next time it will be a lot better. But thank you guys so much for joining me. Audience, if you guys have any questions, feel free to ask. I'll reach back out to the panel for answers, and I'll get back with you. So hopefully not hopefully, in a couple of weeks, I plan on being back here with another topic that we as a Black community need to talk about. Thank you guys so much. I appreciate you guys. Bye-bye.
Thank you.
Thank you.
Thank you.